I'm honored to appear before you today to present the Department of Health and Human Services fiscal year 2026 budget. Debilitating disease, contaminated food, toxic environments, addiction, mental health illness affect families across every race, class, and political belief. When my team and I took the helm at HHS, we set out with clear goals. First, we aimed to make America healthy again, with a special focus on the chronic disease epidemic. Second, we committed to delivering more efficient, responsive, and effective services to the over 100 million Americans who rely on Medicare, Medicaid, and other programs. Third, we focused on achieving these goals while cutting costs to taxpayers. We intend to do more, a lot more, with less. The budget I'm presenting today supports these goals and reflects two enduring American values: compassion and responsibility. I invite the committee to unite around these ideals with me. The United States remains the sickest developed nation, and we spend $4.5 trillion annually on health care, 2 to 3 times more per capita than comparable nations. Clearly, something is structurally and systemically wrong with our approach. Furthermore, healthcare costs are steadily increasing at a rate 2% greater than the economy. If we don't staunch this unsustainable hemorrhage, we will ransom our children to bankruptcy, servitude, and disastrous health consequences. Yes, an exploding debt is a social determinant of health. We won't solve this problem by throwing more money at it. We must spend smarter. We will shift funding away from bureaucracy toward direct impact. Some things at HHS will not change. We will preserve legacy programs like Medicare, Medicaid, and Head Start as the foundation of the MAHA agenda. Vulnerable populations, seniors, and veterans deserve consistent access to care, and I will ensure that they receive it. Today, 83 million Americans, urban and rural, lack adequate access to primary care physicians. We will prioritize these families, especially Native Americans and Alaskan communities. We will protect IHS funding, streamline its operations, and give the tribes more autonomy for managing their resources. Let me be clear, we intend to make the Trump HHS not just the most effective, but also the most compassionate in U.S. history. Our official budget statement outlines many priorities, but I will highlight a few. First, we will consolidate programs to better tackle mental health and addiction. These issues now rival chronic disease in their impact. HHS will aggressively combat the opioid crisis, especially the spread of synthetic drugs like fentanyl. We will empower state, local, and tribal leaders to create effective solutions. Second, we will address nutrition, physical activity, and healthy lifestyles. The President's budget requests $94 billion in discretionary funds to support these priorities, including the Administration for a Healthy America. We will emphasize healthy eating and Head Start and ensure the program continues to serve its 750,000 children and parents effectively. Third, we will equip the FDA to expand its food safety efforts through research, regulations, independence, and education to remove harmful chemicals from food and packaging. And we are already doing this more aggressively than any other administration in history. We will fund cutting-edge research at the NIH while cutting risky or non-essential services. That includes ending of gain-of-function experiments and research based upon radical gender ideology. At the CDC, we'll return to its core missions: tracking disease, investigating outbreaks, and sustaining public health infrastructure while cutting waste. And I'll add, in response to your critique about the measles, we are doing a better job at CDC today than any nation in the world at controlling this measles outbreak. I'm happy to elaborate on that afterward. Fifth, we will eliminate DEI funding and redirect resources toward real poverty reduction. We will move beyond lip service to communities of color and take meaningful action to meet their needs. 6, we will strengthen cybersecurity and health IT. The AI revolution has arrived, and we are already using these new technologies to manage healthcare data more efficiently and securely. Finally, we will rebuild public trust that eroded through years of industry capture, corruption, waste, and misplaced priorities, including by some of the gentlemen that you just mentioned, Ranking Member. We will launch a new era of transparency in public service, creating an honest, science-driven HHS that answers to the President, to Congress, and to the American people. I look forward to working with Congress to pursue this mission together as a bipartisan cause. Let's work side by side to make America healthy again.